So what, at this point, if somebody believes that they may have come in contact with someone who has been confirmed case or presumptive case of COVID-19, they're sick, what should they be doing at this point?
So right now across the world really, but also in our nation, since our president declared a national state of emergency, people in this country are being advised to practice social distancing. So that is important regardless of symptoms. So even people who don't have symptoms right now really should be isolating themselves from others. But that's especially true for people who are ill. So the concern is that if someone is sick with COVID-19, they can spread their infection to other close contacts. And the way this virus is spread is essentially through what are called respiratory droplets. If someone coughs or sneezes, those droplets can be kind of projectiles from their mouth, their nose, and can travel usually about a distance of 6 feet before their weight drops them to the ground. So that's why we're recommending a distance of at least 6 feet from anyone who could be ill. So people who are ill, we also want to teach them to cover their cough. If they have a mask, they can use it, although they really don't need a mask. We want to be conserving masks for healthcare workers who need them as they are in very short supply right now. But and someone who's ill can equally cover their cough with a tissue, or if they don't have a tissue, cough into their elbow. The tissue, if used, should be thrown away immediately. But we want to contain as many of those respiratory droplets as possible so we're not kind of spreading them into our environment, coughing onto our hands, and then touching surfaces which are then touched by other people. So the other way that someone can get this is not just through either being coughed directly on and inhaling those respiratory droplets, but also if they get on their clothing or their hands and then they touch their eyes, their nose, and their mouth, because virus particles can also enter the body through mucous membranes, and those are our eyes, nose, and mouth. There's no evidence so far that the virus can be transmitted through food or through other packaging, or that someone can get it just by kind of casual distanced contact more than 6 feet away walking by someone. But really what we're trying to emphasize is that absolutely if someone has an influenza-like illness right now, fever, cough, body aches, that they should be isolating themselves at home from other people, even including their close contacts in the house. So if there is possibility to sleep in a separate bedroom, that would be a good idea. If they need to be around other family members, they should try to cover their mouth whenever they're coughing, as we described. If they have a mask, they should wear it when they're within 6 feet of other family members. And other things they can do is that they can clean their house, all high-touch places like light switches, door handles, the garbage can, things that everybody will touch in the household with bleach wipes, keeping the area as clean as possible. If someone gets sick in your household and other people in your household get ill, the illness should hopefully stop there. If transmission just happens within a family unit or close contacts within a household, then doesn't leave the house because we're all practicing social distancing, that's how we can stop new cases from coming and coming and coming. However, if people continue to practice life the way they normally do and look at this like a snow day or play dates, or everybody's off from work, we can all still gather at the park and play, or we can all have families still come over to each other's houses, then we're really effectively creating the same social environments we otherwise would have had schools, restaurants, and bars and workplaces all stayed open, and it's really defeating the purpose of social distancing. We're trying to make sure that whatever virus is out there already stays contained within the people who are infected without spreading it to others.